Okay, let's dive into this. If you've been thinking about your reproductive health recently, you've probably noticed your social media feeds just absolutely flooding with ads for at-home fertility tests, right? They're promising convenience, privacy, and vital answers, all dropped off right at your front door. But, how much can a simple finger prick really tell you about your ability to have a baby? Well, today, in this explainer, we're completely demystifying the world of at-home fertility tests. We're going to break down exactly what they're looking for, we'll compare the top brands side by side, and figure out when you actually need to step away from the kit and head into a real clinic. Let's get started.
First off, if you've been feeling stressed, overwhelmed, or even a bit anxious about your reproductive health, I really want to validate those concerns right out of the gate. According to the CDC, infertility affects 13.4% of women aged 15 to 49 in the US. I mean, to put that into perspective, that is a massive portion of the population. Navigating fertility isn't just some niche issue. It is a very common, very real reality for millions of people. And that is exactly why understanding the tools that are actually available to you, like these at-home tests, is just so incredibly relevant right now.
So, here's our roadmap for the explainer today. We'll start with the basics of fertility testing. Decode the fertility hormones, check out the top at-home tests, weigh at-home versus in-person clinics, and finally cover exactly when you should see a doctor.
All right, part one, the basics of fertility testing. What are these tests actually looking for? So when you use an at-home kit, you're usually sending off a quick finger prick or a urine sample in the mail to a lab. And then a few days later, you get this digital snapshot of your reproductive health. But before we go any further, we need a quick mythbuster here. At-home tests offer estimates of your hormone levels. They absolutely do not predict your exact chance of getting pregnant. Honestly, this is arguably the most important takeaway of this entire explainer. These tests are basically providing a broad overview of the hormones circulating in your body at a specific moment in time. They can't give you a definitive diagnosis, and they definitely cannot guarantee whether or not you're going to conceive. Think of them as a tool for gathering information, not a crystal ball.
Let's move to part two and see how this builds. Decoding the fertility hormones, or as I like to call it, making sense of the alphabet soup. Because when you get your results back, it literally feels like you're reading a bowl of alphabet soup. Let's translate what these acronyms actually mean for your body. The heavy hitter, the one you're going to see on almost all of these comprehensive tests, is AMH. That stands for anti-Müllerian hormone. This hormone gives us a general sense of the number of eggs remaining in your ovaries, which doctors call your ovarian reserve. Now, this is a fantastic metric if you're considering something like egg freezing or IVF. But there is a major medical caveat here. Studies actually showed that for people who are not currently experiencing fertility issues, AMH levels do not predict your natural fertility or your chances of getting pregnant right now. Basically, it tells you about quantity, not necessarily quality.
Now, beyond AMH, these kits are checking a variety of other vital hormones too. You've got FSH and estradiol, and they work alongside AMH to give a much fuller picture of that ovarian reserve. Then there's LH, which surges right before you ovulate. That's actually what standard urine ovulation kits are tracking. Some tests also check prolactin and testosterone, and I really want to highlight TSH here, which measures your thyroid function. Dr. Allison Petrini, who's a reproductive endocrinologist, points out that thyroid problems can actually contribute to irregular or even absent periods. So checking your TSH can sometimes uncover a totally hidden roadblock to regular ovulation.
All right, section 3, top at-home fertility tests. Let's look at the contenders.
Now, what's really interesting about this slide is seeing how these brands actually stack up against each other. Let's vet the top blood test options so you can see which one might fit your specific needs. First up, we have Modern Fertility at $179. It's definitely the most comprehensive, testing up to 7 hormones with results back in 7 to 10 days, plus the results are reviewed by medical staff. Next is LetsGetChecked for $139. This one is great if you want fast answers. You get results in just 2 to 5 days, though it only tests 4 hormones. And then we've got Everlywell at $149. It tests 5 hormones, but notably it actually includes a test for total testosterone. And since testosterone levels are linked to AMH function, that can be a super helpful addition for some folks.
Continuing our ultimate comparison here, let's look at 3 more really unique options. The Mirror Starter Kit at $199 isn't a mail-in blood test at all. It's this highly advanced urine tracker that gives you numeric hormone levels at home in literally 15 minutes. That is brilliant for tracking ovulation, especially if you have irregular cycles. On the flip side, if you're someone who just hates pricking your own finger, LabCorp offers an ovarian reserve test for around $175, where you actually go into a professional lab to have your blood drawn. And finally, MyLabBox at $149 is a fantastic women-owned brand that gets you results on 4 key hormones very quickly, typically in just 1 to 5 days. Moving on to Section 4, at-home versus in-person testing. Time for a reality check.
Okay, it is totally amazing that we have access to this kind of data from the comfort of our living rooms. But we really need to balance that accessibility with clinical reality. At-home tests are incredibly convenient, for sure, and they're often more affordable if you don't have health insurance, which lets you test on your own timeline. A lot of clinics will actually make you wait until you've been trying to conceive for 6 to 12 months before they'll even run these labs. But let's look at the other side of the coin. In-person testing with a doctor provides a truly holistic diagnosis. It accounts for your entire medical history. And crucially, at-home tests can actually be inaccurate if you have underlying conditions like PCOS. A doctor's visit makes sure the context of your whole health is considered. Plus, if you have insurance, an in-clinic visit might honestly be cheaper in the long run.
This quote just hits the nail on the head regarding the medical consensus. Dr. Amanda Callan from Yale Medicine says, "I would consider at-home testing a potential supplement rather than a replacement for testing and evaluation in a clinic. Taking an at-home test can feel super empowering, but a single weird hormone level on a mail-in kit can cause a massive, completely false sense of alarm. Remember, these kits are just one piece of the puzzle. They are not the doctor themselves." And speaking of that whole puzzle, measuring female hormones is definitely not the only factor in getting pregnant. Not by a long shot. There are factors far beyond hormones. We're talking uterine abnormalities, endometriosis, fallopian tube blockages, none of which a simple blood test can see. Furthermore, male factor infertility actually contributes to 40% of cases in heterosexual couples. That is almost half. And get this, in up to 30% of cases, the causes of infertility remain completely unknown, even to the top specialists. So a hormone kit, it's really just scratching the surface.
Which brings us to Section 5, when to see a doctor and your next steps.
So, knowing all of this, when is it exactly time to take action? Well, medical experts and the CDC have very clear guidelines on this timeline. If you are under the age of 35, the standard recommendation is to try to conceive for 12 months before consulting a fertility doctor. However, if you're 35 or older, that window shortens. You should definitely seek a professional medical evaluation after just 6 months of trying.
But, there are exceptions to every rule. So the crucial point is this. If you already know you have conditions that impact fertility, things like PCOS, endometriosis, or if your partner has known fertility issues, do not wait for those standard 6 or 12-month marks. Experts advise seeking an evaluation right when you start trying to conceive. And that brings us to our final big thought for today. Are at-home fertility tests your final answer or just your starting line? These kits are absolutely incredible tools for empowerment. They give you accessible, early insights in your reproductive health that literally just weren't available a decade ago. But as we've seen throughout this explainer, they aren't definitive, they don't replace a doctor, and they simply don't capture the entire complex picture of human reproduction. So use them to spark your curiosity, use them to gather data, and most importantly, use them to start an informed conversation with your healthcare provider. Thanks for joining me on this explainer, and keep asking the right questions about your health.